If you have a choice between hospital and being at home, my choice is to be at home.
I'm able to socialise, I'm able to be active in the community.
It's about GPs working with all the existing services, but remembering that the patient is at the heart of this.
It's about trying to encourage people to do things for themselves.
It'll mean that my time will be more appropriately spent doing what I've been trained to do.
Hopefully over the next few years, people who use our services will notice that there is a lot more partnership working, that the local authority and health organisation, as well as third sector and independent sector, are working closely together to deliver a more joined up service. But at the same time, that the individual is at the centre of everything that we do.
If you talk to people who receive services, what they say overwhelmingly are a few simple things. Please come and look after me in my home or local community. If you do so, can you work in a team? Can you talk to each other? And can you be qualified?
We know that many older people and people with health conditions in the city are in touch with lots of services. It might be the hospital, it might be a district nurse, it might be social workers, or indeed the voluntary sector. We want people to know where they can best get the help they need. We want them to have a single point of access for either health or social care services. And we want our teams of workers to be working better together in a more coordinated way, bringing in support from the voluntary and community sector where necessary and where needed, and where people are able to be supported in their own communities. And if we can do that well, then we believe the people of Leeds will be better served by all of our services in the city.
In the context of mental health and learning disability services, it's our intention always to provide care programmes for people that fully reflect their health needs as well as their social care needs. And actually the integration process will enable us to do that in a much better way.
Hospitals need to think differently in terms of they're only part of someone's care. I think we've got better in Leeds at doing that. So the ward that we're on today is very much about coming into hospital being assessed properly but speedily. And the reason to do it quickly is that we know the longer you're in hospital, the more difficult it is to get back home.
One of the things we really need to solve is how we get the communication right between the community and the hospital. So if someone is being supported at home and helped to manage their own condition better, and then something goes wrong, perhaps late at night, so they end up in hospital, that team needs to be able to know straight away so they can immediately start the work to help get things right, to help that person get straight back out to the community.
I've got different various illnesses, COPD and heart problems, diabetes. I have no problem going into hospital. It's just if you have a choice between hospital and being at home, my choice is to be at home. I can't sit in the easy chair like this at hospital. I've got equipment that they've put in for me. I call it my health buddy. It takes temperature, blood sugar, blood pressure, pulse and oxygen levels. Keep your hand in, that's what I say.
I've got a progressive neurological condition, which means that my impairment has become worse over 20 years now. I want to remain independent, whereby I have people that care about me and care about my safety, for instance, but also allow me to take risks, because life without risk is like no life at all, as they say.
We need to look at the inequalities amongst our diverse population groups. Teams are getting bigger, more diverse, and trying to cover many more angles. So it is more about GPs and accepting that we're not working alone. We are working with a team of people.
Patients absolutely hate it when you've got lots of different services going in there asking the same questions over and over and over again. And the main benefit for patients now is the time constraints, because got rid of that now. Something that might have taken hours, days, weeks, months previously, we can now deal with direct. If it's something really important, we can have that face-to-face conversation with the social worker.
The district nurses are coming back from visits and identifying where somebody might need the support of social services. And it means that on certain occasions the social worker has been able to go out straight on a visit with the district nurse to go and see somebody in the community, which is a much quicker response.
This is the first opportunity within Leeds to have district nurses and social workers being able to share information and plan patients' care together. This is innovative and it's the future for healthcare and social care within Leeds.